Good day, everyone. My name is Dr. Efo Effiong Edet. I'm a consultant gynecologist with special interest in gyneendoscopy and fertility. I'm an IVF specialist. Today I'll be talking about IVF. IVF simply means in vitro fertilization. What does in vitro fertilization mean? It's a procedure that involves several steps where the client, that is a woman, will have to be stimulated by giving her injection as soon as she starts seeing her menses. Talking about the indications for in vitro fertilization. The indications can be due to the female factors or male factors. Let's start with the male factors. For the male partner that has a very, very low sperm count, that may be an indication for IVF. The male partner that has no sperm, the condition we call azoospermia, indication for IVF, where we use the the spouse's eggs, but we use sperm donor in such situation. Then for males that have that are infected with HIV, may not want to use his sperm, though there are special ways of can process the sperm and then still use the man's sperm, process the sperm where the HIV viruses are exempted from the sperm. Then can use that. Otherwise, you can use the woman's egg with a sperm donor. Male factor commonly is due to tubal factor, where the tubes are blocked, which could be due to pelvic inflammatory disease, which could be due to conditions we call damage due to a condition we call endometriosis, or maybe previous surgeries with scarring affecting both tubes. For such patients, we may have to do IVF form. Then, of course, women, menopausal women, or patients that have problems, hormonal factors, which could be menopause due to menopause. Of course, women with reduced, in this case, women, their ovarian reserve is very reduced. Or younger patients with condition we call premature ovarian failure, where the ovarian reserve is reduced. These patients may do IVF for where we use egg donor. They use their husband's egg, sperm, fertilize, then are introduced into their womb. So these are some of the conditions, some of the indications for IVF. I want to say that there are different protocols we use for the stimulation of the ovaries of these patients. Aim is to generate multiple follicles, so that we have at the end of the week we have enough follicles oocyte to retrieve from the follicles. Different centers use different protocols, but generally, like I said, there are different protocols. We have the long protocol, we have the short protocol, we have the ultra short protocol. Here at my center, we use the short protocol. For the short protocol, what we do, we wait for the woman to see her menses. From the second day of her menses, she's given hormonal injections. Can use a combination of follicle stimulating hormone and luteinizing hormone, or follicle stimulating hormone is given from the second day of her menses. The dosing depends on the what you want. I won't mention the dosing here. Some persons may want to give as high as 300 international units. May want to give 225, depending on the age and several factors, which time won't permit me to mention here. Then, of course, while the injections are being given, the patient is being scanned. We look at the size of the follicle. As soon as it gets to a particular size, as 14 millimeters, second injection is injected. Of course, different protocol. People can use the flexible protocol or regimen, or the rigid regimen. I want to go into that by expanding because of time. Second drug is introduced. Then this drug is to prevent premature, what we call premature LH surge. Then patients is monitored, ultrasound scan is being done, looking at the follicle, the size, the number. Then the endometrial lining is measured. The benchmark is 8 centimeters, though some use 8 millimeters. Some may use 7 millimeters for the endometrial thickness. Then as soon as the follicle gets to a size of 18 millimeters, ovulation, another drug is to be given. We call that human chorionic gonadotropin hormone, but 10,000 international unit is given. Then 36 hours, the eggs are retrieved. Procedure we call egg retrieval. Okay, so using transvaginal ultrasound scan with specialized needle called retrieval needle, the eggs are retrieved vaginally. Then of course the husband's sperm is collected using special container, to get the sperm. And note that you must have examined the sperm to be sure the sperm is okay before this time. Then of course the embryologist samples are handed over to the embryologist. Then of course the special condition, the sperm and the retrieved egg incubated, and we expect fertilization to occur. Then we select the best embryos. Then usually we do the transfer. 5th day after collection of the eggs, we transfer the embryos, the best embryos. What we do, we call embryo transfer into the cavity of the womb. Usually, I must say here that the embryos are stored in the incubator in an environment mimicking the womb. Then the day 5, we do embryo transfer. Of course, the patient is continuing on the medication progesterone to give support to the pregnancy and head implantation of the embryos. And again, of course, to help prevent pregnancy loss. 2 weeks after the transfer, pregnancy test is done to test whether the pregnancy are the embryos implanted. Of course, if the eggs implanted, the patient is continued on the hormonal agents, then over time handed over to our obstetrician. Thank you and God bless.